welcome to Buzz Indiana's Underground Business Voice. My name is Tony Celzo. I'm here with Tom Hammett, Acupuncture of Indiana, here at the Bob, Studio 19, as we like to call it. And Tom, acupuncture, I mean, talk to me about, is it what I think it is? Is what I see, you know, it's the pins in skin?
That's what it is, Tony.
Okay.
Acupuncture is just one part of an entire system of medicine. It all comes under the umbrella of Oriental medicine.
Okay.
And acupuncture is just one tool or subset of skills.
Okay. Now, how'd you get into this?
Oh my gosh. Tony, I've been a nurse for 30 years.
Uh-huh.
And I had the opportunity to meet with an orthopedic surgeon.
Sure.
Because of an orthopedic injury that I had.
Okay.
And we had to schedule a surgery, and the surgery was going to be so extensive I was going to be off work for 6 months. And
wow.
Lo and behold, 3 days before the surgery, one of my ER physicians said, "Tom, I do a little bit of acupuncture. Would you like for me to see what I can do?"
Wow.
Well, we started. I've never had the surgery. I've been fine. That was my springboard.
Yeah, amen. So that got you into it, right?
That's right.
And then when did you start the company?
We actually started Acupuncture of Indiana in 2004.
Okay. And since then, you've been helping people ever since?
Ever since, that's what I do.
Now, I know, I want to give a little bit of a testimony here, and this is just kind of through my office. Amy Woodall has had a problem with her youngest coming with allergies, right?
That's correct.
And he to the point where he's always had a sniffly nose. He's always really been one of those kids. It seems like they're always sick, and they couldn't figure out what, you know, that he's always been allergic to something. Actually, I think they did know what he was allergic to. And he went in, and she did a session with you guys, and he's already been cleaned up for like 2 weeks. I mean, he hasn't had a problem with, you know, with the runny nose. I mean, and that happened with acupuncture.
Actually, the treatment is based on Oriental medicine, but for the allergy work, we do not use needles.
No kidding.
There are acupuncture points along either side of the spine, and we percuss those rather than needle them.
Okay.
We do that with our adult allergy patients and our pediatric allergy patients. It works beautifully for young children with allergies, particularly those children with all those nasty food allergies.
Wow. So, and what she was telling me, that you're actually building like almost, is it a new way for them to think about the food, or that? How does that work?
Well, once we identify what the patient is allergic to,
yeah.
when we percuss those acupuncture points along the spine,
yeah.
it resets the body. It's much like going to the circuit breaker box in your home and resetting every one of those breakers so that your body no longer sees that particular substance as harmful.
Wow, that is awesome. So a big question that everybody has is, does it hurt?
The acupuncture?
Yeah.
Oh, no. Can I show you?
Sure. I'd love to see.
Let's see what happens.
Okay.
Tony, all these needles that I use, they're all individually packaged, all pre-sterilized. We're just going to
I'll be honest, I'm a little nervous.
We're just going to pick a point on Tony's arm right here.
Okay.
What'd you feel, Tony?
Nothing, really.
Nothing.
Wow.
Can I do it?
Yeah. We got volunteers now.
No, I was going to say I would put it in.
Well, let's take that out of there since
Okay.
we're not treating anything.
Okay. So it really doesn't, there's no pain negative, right?
I never tell my patients it's totally painless.
Okay.
Some points can be more tender than others.
Okay.
Right. And nobody likes a nasty surprise. So if I know a point may be tender, I always let my patients know in advance.
Now, Tom, changing gears on you, I mean, obviously Amy's story, I mean, what are the type of things that you can treat for with acupuncture?
Well, what the truth of the matter is, the short list is the list of things that we can't treat.
Okay.
With this ancient system of medicine,
Sure.
I evaluate and treat most everything that my Western counterparts treat.
Okay.
From metabolic disorders, diabetes,
Okay. Wow.
heart disorders, high blood pressure, lung disorders, COPD, emphysema.
Yeah.
Pain has always been a big attractor for
And
acupuncture.
what's the worst case scenario? They go in, they try it, they see if it helps them, right? And if it does, great. If it doesn't, they go on to a traditional means of medicine.
Absolutely.
Oh, That is awesome. So, who are you looking to network with? Totally changing gears. What are the type of businesses that you think could be good and strategic for you? I mean, am I crazy to think like massage therapists? Anybody who's in wellness is a great referral source for you? I mean, help me with that.
I think you're on the right track. I think it's people who are involved in wellness. Those are the folks that will have interactions with individuals that I can perhaps help them.
Yeah, because maybe they're already open to it. They're already seeking those paths, and they're already you got kind of what we would call a strategic advisor at that point, right?
That's correct.
Wow, Tom, what a great story. I appreciate you being here. You've been buzzed.
Thank you.